Good morning, it's Dr. Raymond. Thank you so much for watching my YouTube channel and welcome to Wednesday Wellness, where we're going to continue our discussion on diabetes. So last time we talked a little bit about what diabetes is, the different types of diabetes. We touched briefly on nutrition, and then we ended our discussion with how diabetes is diagnosed. So if you missed that video, stop this one, go watch that one. The link is in the description, and then come back. So we're going to continue today's discussion on diabetes with the management and treatment of it. So I talked about in our first video that patients have a vital role to play in helping to manage their diabetes. And there are two very important ways that patients can help manage blood sugar levels. The first is exercise. And I know patients have such a hard time with this and they don't like when we bring it up, but it is so important to you managing your diabetes. The President's Council on Sports, Fitness, and Nutrition recommends that all adults engage in 150 to 300 minutes of moderate intensity exercise or 75 to 150 minutes of vigorous intensity exercise or any type of combination of the two. In addition, they also recommend that adults engage in muscle strengthening exercises involving all major muscle groups at least twice a week. So if you broke down 150 minutes over the week, it would be about 30 minutes of exercise a day. Moderate intensity can include brisk walking. So some patients tell me, I haven't exercised in years, I can't do that. That's okay. You can start wherever you feel comfortable. There are things that you can do starting today to help you improve your diabetes and increase your physical activity. Number one, invest in a pedometer. You can get a pedometer on Amazon for $10. They're extremely inexpensive. And if you get one, aim for about 10,000 steps a day. Number two, if you don't want to get a pedometer, then find little ways to increase physical activity. Take the stairs. I see so many people use the elevator all day long. Take the stairs, people. Forgo the elevator, forgo the escalator, and just take that extra step. Other things that you can do like in that manner is when you go to the store, park farther. I see people circle around for 20 minutes trying to find a close parking spot. And that time you could have walked there from a farther parking spot, got what you needed, and came back out. So you can incorporate those things just to increase physical activity and work yourself up to the 150 minutes a week. Another thing to kind of help you increase your physical activity is to get a partner. Walk with someone, or even join a local gym. Planet Fitness has memberships for like $10. And I found that if you go with a partner, if you have a friend, you are more likely to stick with it and be consistent when you have to answer to someone else. You're accountable to them. They will ask you, hey, where are you? Where were you last week? And oftentimes when you join a gym, they have group fitness classes. So that's another way to kind of increase your physical activity, and you have that accountability. It's fun, you get to know each other. All those are ways that you can increase your level of exercise and work yourself up to the recommended 150 to 300 minutes per week. The other important thing that diabetic patients can do is to eat a healthy diet. So we talked in the first video that food is composed of 3 macronutrients: fat, protein, and carbohydrates. So a well-balanced diet is one that consists of all of these. The typical American diet consists of about 50 to 60% of carbohydrates, which just means that about half or more of what we eat comes from carbohydrates. So diabetic patients could greatly benefit from decreasing the amount of carbohydrates. And we'll talk about carb counting, meal planning, and how to read nutrition facts in our last video in the diabetic education series. But it's also important for diabetic patients to take into account the type of carbohydrates that they are eating. all carbohydrates are not equal. Some carbohydrates will raise your blood sugar more quickly than others. This is where the glycemic index comes into play. The glycemic index is just a measurement of how a food containing carbohydrates affects your blood sugar. It's recommended that diabetic patients eat foods that are low to medium on the glycemic index, which means that compared to eating pure sugar, these foods will raise your glucose not nearly as quickly as eating candy or some of the other things. So foods that are low on the glycemic index include oatmeal, and not just any type of oatmeal. I'm not talking about the instant oatmeal. I'm talking about the rolled oats or the steel cut oats. Other things that are low on the glycemic index are most vegetables, including peas and carrots, sweet potatoes, yams, corn, and most fruit. Things that are medium on the glycemic index include brown rice, wild rice, couscous, pita bread, rye bread, and 100% whole wheat bread. Things that should be avoided in diabetic patients and that are high on the glycemic index include so many of our processed foods, our snack foods like pretzels, chips, crackers, pasta, macaroni and cheese mixes, instant oatmeal, and a lot of our cereals like the puffed rice and the corn flakes, and even melons and pineapples are high on the glycemic index. So when you are preparing meals and grocery shopping, you should take a few simple things in consideration when it comes to the glycemic index. The more fat and fiber a food has, the lower it is on the glycemic index. The more processed it is, like I mentioned, a lot of our snack foods, a lot of our convenience foods, things that are found in the vending machine, are typically high on the glycemic index and should be avoided. The second thing we should keep in mind with our diabetic patients is that while we do take the glycemic index into account, you still have to manage portion sizes. So you still have to manage the amount of carbohydrates that you're eating on a daily basis. The third and final thing that take away when grocery shopping and meal planning is that the glycemic index of a food eaten alone is different from that eaten in combination with other foods. So if you eat something that is high on the glycemic index, when you combine it with something that's low on the glycemic index, it can kind of help balance the effects that it would have on your glucose levels. So now we'll talk about treatment options. So we talked about ways that patients can help manage their diabetes. Doctors prescribe medicines for diabetes, and now we'll talk a little bit about the different types of medications. So we have oral medications in the form of pills that we can take, but we also have insulin therapy. So we know from the first video that type 1 diabetics have autoimmune destruction of the pancreas, and those cells that produce insulin are destroyed. So the therapy for type 1 diabetics is always insulin because they cannot produce any insulin. For type 2 diabetics, the treatments vary. In someone that's newly diagnosed with diabetes, one of the most common drugs that we prescribe first is a drug called Metformin or glucophage. This drug helps to decrease the body's ability to produce glucose. So in addition to the glucose that we eat, our body is also able to make glucose from certain building blocks in a process called gluconeogenesis. So metformin helps stop that process, and it also helps the tissues to be more sensitive to insulin. As we talked about, type 2 diabetes is largely an insulin resistant disorder. So metformin helps make the tissues more sensitive to insulin. Some of the most common side effects that patients experience includes diarrhea, nausea, and vomiting. And typically these symptoms do not last for the time of treatment. They usually occur over the first few weeks and then resolve. So now we're going to talk about other drugs that are prescribed to diabetic patients. This is in no way an exhaustive list of all the diabetic drugs. There are so many drugs, there are so many combination drugs, meaning that there are two or more drugs in one pill. So there are so many types of drugs, but we'll focus on some of the most common ones. The first drug, and we'll group them by drug class, and we'll talk about how they work on your body. We'll talk about the most common side effects, and then special considerations when taking the drug. So the first drug class is referred to as sulfonylureas, and this includes glimepiride, also known as Amaryl, glipizide or glucotrol, and then glyburide or glinase or micronase. And these drugs work simply by stimulating the pancreas to release more insulin. Some of the most common side effects are hypoglycemia, which is low blood sugar. And we'll talk more about low blood sugar in a few minutes. Another common side effect is weight gain. So special considerations for these drugs is that they cannot be used in type 1 diabetics because, like I said, it stimulates the cells of the pancreas to release insulin. Type 1 diabetics are not able to make insulin, so they cannot use this drug. In addition, it's not effective on type 2 diabetics that no longer produce insulin as well. So you have to have a functioning pancreas to take these drugs. The second drug class we'll talk about are the glitazones. And one of the most common drugs in this drug class is pioglitazone or Acarbose. And this drug works by making the tissues more sensitive to insulin. One of the most common side effects is swelling in the legs. So special considerations for this drug is we typically don't prescribe it in patients that have heart failure. Because patients with heart failure, they often struggle with what we call volume overload and can already experience a lot of leg swelling and other things. So to not make matters worse, we typically don't prescribe it in that patient population. Another drug class is called alpha glucosidase inhibitors. And one of these drugs is Acarbose or Precose. And the way that this drug works is it stops the enzyme that breaks down carbohydrates. So the enzymes that break down the sugars and the starches, it stops that. But because of the way that it acts on the body, it can cause a lot of abdominal symptoms, including bloating, nausea, vomiting, and diarrhea. And special considerations for this drug is that when it's combined with the sulfonylureas, the glimepiride and glyburide, it can increase the risk of hypoglycemia. Another popular drug class are the GLP1 receptor agonists. And you have probably seen these drugs advertised on TV. They are the injectables, but they are not insulin. And they include Trulicity, Bydureon, Ozempic, and they work by slowing the digestion process, and they also help prevent the breakdown of glycogen. Glycogen is a storage form of glucose. When we eat, as I said, the pancreas releases insulin, and that insulin takes up the glucose to the cells. When there's excess glucose, the body then stores that as glycogen to be used for further use. So this drug class helps prevent that breakdown of glycogen and helps slows down the digestion process. Some side effects include a modest weight loss, about 1 to 6 pounds. Also helps decrease the appetite since it helps slows digestion. But there are also some abdominal side effects, including nausea, vomiting, and diarrhea. Special considerations is that it can increase the risk of pancreatitis, And it cannot be used in patients that have a diagnosis of medullary thyroid cancer or another endocrine disorder called MEN. Another drug class closely related to this one is the DPP4 inhibitors, and this includes Onglyza, Januvia, and Tradjenta. And these drugs work similar to the GLP1 receptor agonist drugs that I just mentioned, the Trulicity, the Bydureon. It works by slowing the digestion process. It helps stop the breakdown of glycogen, but it also causes increased release of insulin from the pancreas. And side effects for this, there can be an increase in the amount of upper respiratory infections. Another drug class includes the SGLT2 inhibitors, and this includes Jardiance, Farxiga, and Invokana. And they work by helping decrease the amount of glucose that is reabsorbed by the body and releases it into the urine. So because it works on the kidneys, you basically urinate out the glucose. We cannot prescribe it in patients that have kidney disease. And some of the side effects, you can have an increased frequency of urinary tract infections. So those are pretty much the basic drug classes. And now we'll move on to insulin therapy. So as I touched on earlier, insulin is always a treatment for type 1 diabetics. For type 2 diabetics, we prescribe insulin when they just aren't controlled on oral medications. Often we have tried numerous medications without any success on adequately controlling the glucose. So we may initiate insulin at that time. Sometimes when patients originally come to the clinic or the hospital and they have an extremely high hemoglobin A1C. We talked about in the first video that the hemoglobin A1C is the average glucose over the past 3 months. So when patients are newly diagnosed and they have a high hemoglobin A1C of like 10 or greater, typically we will start them on insulin at that time because they may not be able to be managed on oral medications alone. We also start insulin in patients that are newly diagnosed in the hospital. So sometimes patients will come to the hospital and they may be in what we call DKA or diabetic ketoacidosis, which they have severe hyperglycemia. This is a medical emergency and requires admission to the ICU, where patients are treated with IV insulin in a continuous infusion until blood sugar levels and everything else has normalized. So when patients present like that, we typically prescribe insulin. It does not mean that they need to stay on insulin. Oftentimes, after they're released from the hospital and they follow up with their PCP, their primary care physician, over a few months, and the glucose levels are well controlled and the physician does lab work, shows everything is fine, then they can oftentimes be transitioned back to oral medications. So there are 5 types of insulin, and they are grouped by how fast they act on the body and how long they act on the body. So we have our rapid acting insulins, and that includes Humalog, Novolog, and Apidra. And they start to work on the body within about 5 to 15 minutes and last for a few hours. Then we have the short-acting insulins, which is regular insulin, and they start to act in about 30 to 60 minutes after taken, and it lasts for about 6 to 8 hours. We then have intermediate acting insulins, or MPH, and they will start acting in about 2 to 4 hours and then typically last for about 10 to 20. So the rapid acting and the short acting we usually refer to as pre-meal, meaning we have patients take them prior to eating, and then eat their meals. So as they eat carbohydrates, that insulin is readily available to take up that glucose and provide it as energy to the rest of the cells. After the intermediate acting, the NPH, then we have the pre-mixed insulins. So this usually consists of NPH and one of the rapid acting insulins. And then the fifth and final type of insulin is the long acting insulin. And this consists of Lantus, Basaglar, Toujeo, Tresiba, and Levemir. And they start acting within about 30 minutes to an hour and a half after they're taken, and they can last anywhere from 17 to 42 hours in the body. One of the risk factors for insulin therapy and complications is hypoglycemia. So I briefly touched on that earlier, so now we're going to discuss it in detail. Hypoglycemia is a medical emergency. Typically, when a diabetic patient has glucose levels of 60 or lower, they start to have symptoms that their heart is racing, they get nauseous, and start to sweat. It's important that you recognize these symptoms and act quickly to remedy them, because as time goes on, the symptoms start to progress and it leads to confusion, vision loss, seizures, coma, and even death. So it's recommended that diabetic patients always carry either glucose tablets or juice in the case of hypoglycemia. So you recognize those symptoms and you can immediately ingest the glucose tablets or juice. A good rule of thumb is that low glucose levels can be remedied by ingesting about 15 grams of carbohydrates, and that can be found in a tablespoon of sugar or honey, a cup of juice or soda, or a piece of candy. And you can also speak to your physician about prescribing an emergency injection glucagon kit that can quickly raise the glucose levels. I sincerely hope that this lesson was informative and helps you on your journey to wellness. I pray that you be well, that you have an amazing week, and you join me next week as we discuss the complications of diabetes. Make sure you hit subscribe, go to my website www.themedicalinstituteforwellness.com for more information, and the link is in the description. I will see you soon.